Good evening, guys. If I'm visible and audible, so everyone just give me a thumbs up or some sign so that we can start with the session. Okay, so Dr. Tarun. Hi, Dr. Tarun. Okay, good. So let us start with the session now. This session is basically based for FMGE students. Hi, Dr. Tarun. Hi, everyone. Am I visible and audible? I'm sorry, there was some problem here. Hi, guys. Okay, so let me just begin the session by introducing myself. Deepesh. Okay. So I got a thumbs up. Now. So hi, guys. So this session, guys, is based for FMG students. All right. Normally, this session what we are going to take is a revision for the FMG students who are there. Basically, we'll be discussing the topics from anesthesia that are important. Of course, it's a last minute revision that we are going to do. So we'll just see that. Before we go forward, let me just introduce myself to you guys. My name is Dr. Vinish Srivastava. Presently, I'm the head of the department and senior consultant at Fortis Lafarm Hospital in New Delhi. Before that, I was senior consultant here only for the last 8 years, this hospital itself. Prior to that, I was at Maulana Azad Medical College. I've done my senior residency from there and I was also a specialist over there. Before that, I was at Deen Dayal Upadhyay Government Hospital, New Delhi, and I've done my DNB secondary from there. Before that, I was in Mumbai, Grand Medical College. I've done my DA and FCPS from Grand Medical College, Mumbai. Before that, I was in Sion Hospital, Lokmanya Tilak Medical College, Mumbai. I've done my respiratory medicine from there. Prior to that, I was at Symbiosis and I've done my hospital administration from there. Okay, before that, MBBS. So hi, Dr. Rizvi. Dr. Rizvi says looking like Hardik Pandya. Okay, okay, fine. Thank you, guys. Thank you for all that. Okay, let us go forward and continue with the session today. Alright, so that is me playing the guitar and working in the COVID times also, like all of you. Apart from that, I've been teaching students for the last, Dr. Rahul is also there. Good evening. So I've been teaching students for the last 10 years. Alright, students preparing for FMG exams, and almost 8 years to students preparing for postgraduate medical entrance exams. Alright, I've joined the Unacademy. I've been here for quite some time now. This is about the NICT. Just wanted to share with you guys. So basically what we do is just having a discussion, and everyone says that questions come from the class. The questions have not come from the class. It's the discussion that we've had, and most of the questions will be based on that. Okay, and that's what everyone has said. This is from one of the sessions at Unacademy that we had taken. So this was the interaction with the different students that we've had. Okay, and this is the reason that I keep on teaching, is because at the end of the day, with the kind of responses we get, apart from the clinical satisfaction, it's the personal satisfaction that we get for the subject. Okay, guys. So these were few of the things that I was sharing with you. As I said, we are always concentrating on trying to clear the concepts so that things become easy to understand. Okay, and we try to teach every subject in a simplified manner, everyone. Okay, and thank you for all the comments also. Even today I've got few comments, so thank you. Okay, feels good. All right, as usual, we are trying to clear concepts. I'm going to do that today also in a short session that we are taking. Of course, it cannot be a long one that we do, but just a small revision of everything, because I hope by now you people are aware of anesthesia and how questions will be framed on that. So I'll be discussing the various topics that are going to be there. So we've discussed questions not only for INI-CET or NEET PG, but for FMGE also. Everything is available on the YouTube, guys. Everything is available on the Unacademy platform also. we've got lots of classes. You can go through that. YouTube sessions absolutely free. Unacademy also, we have free sessions absolutely free. You can just go through that and check out for the topic of your choice. All right, and let's going forward. So before I even begin, what I'm planning to do for today's session is trying to maybe extend the session even for Monday. So I'll be doing half an hour each. So today in the half an hour session that I'm going to take, what I'm going to discuss is basically what are the topics that are important. Okay, so Dr. Pooja also joins us. Good to see you guys. So let's start with the first thing, pre-anesthetic checkup. Okay, as soon as a patient comes before the OT, I'm just going to start. I hope that you guys are all aware of things. I'm going to be using small words and short forms also. So in the PAC, this is exactly a sort of PAC sheet, all right, which we were using in our hospitals. So forget everything that has been asked. Where is the questions that come? The questions come from airway assessment. The questions come on what addiction needs to be stopped. All right. Physical examination is the same thing as what you do in medicine. All right. Even here, if you see physical history taking of respiratory, cardiac system, abdominal system, renal system, musculoskeletal, everything is just like the medicine history. Okay. Everything is just the same. So where are the questions asked? And that is what we will discuss. The first place where the questions get asked, guys, is about the airway assessment. Airway. All right. Airway assessment. So in airway assessment, you need to remember there is going to be two parts. Airway assessment is going to be for two parts. One is for mask ventilation, when you hold a mask on someone's face, and second is going into intubation. Okay, so basically when you are trying to assess the airway in a PAC, you are trying to see if you will be able to do a bag mask ventilation or not, and whether you will be able to intubate or not. Okay, that is the whole point. So there are the different things that you are seeing over here written, and most of them are asked in the exam also. So therefore, the first thing which becomes foremost important is the mouth opening. So remember guys, mouth opening is always more than 3 finger breadth or 5 centimeter MCQ question. If it is less than that, it becomes a difficult airway. Then comes Malam Patti grading. Important question. I think all of you would be aware about it. Malam Patti grading is 1, 2, 3 and 4. Malam Patti. Everything depends on the way that you see the uvula. Remember, in 1 and 2, normally it becomes easy intubation or supposedly easy airway. 3 and 4 becomes difficult intubation, difficult airway. I am just discussing things in short. Okay, it's a small session where we are just trying to revise the important points from anesthesia from whatever we can discuss. Okay, so mouth opening, Malam Patti grading. Then comes thyromental distance, a place where questions has been asked. A distance between the thyroid cartilage and the mentum. It should be more than 6.5 centimeter. Okay, neck movement is important. Movement of the mandible or the jaw is important. All right, and basically look of the patient. Look as in when you look externally, you have to see any mass, any dentures, any teeth protruding outside, mandible able to protrude outside or not. So basically a look of the patient makes you feel whether it is going to be difficult or not. So the mass, the teeth, mandible, whether they can protrude the mandible outside or not, all right, or the teeth coming outside. So prominent incisors is the way that we describe it to be. Okay, so you are supposed to see all that. All right, so all this is what you see in trying to assess the airway, whether you will be able to do a bag mask ventilation or not, or whether you will be able to intubate the patient or not. This is the first point, and this is where the questions also asked. I have discussed all the points where the questions normally come from. Remember, it's an exhaustive topic. Normally we teach it for 2 hours. I am just taking it in 5 minutes. So I've just discussed the important points where questions are asked. Is that okay, guys? Have you understood? Give me a thumbs up. Then I'll go forward as well. So Dr. Rahul, Dr. Rizvi, Dr. Pooja, Dr. Shreya, Dr. Deepesh. Okay, all of you. Okay, I got a thumbs up from all of you. Next important question that comes here is about smoking, guys. The next point is addiction. When we are taking a history, addiction becomes important. So here, remember, when is smoking need to be stopped? Important question. A patient cannot smoke and come inside the OT for surgery. So remember, if you stop smoking 24 hours prior also, it decreases the level of carboxyhemoglobin. However, the best time for which the smoking needs to be stopped is almost 4 to 8 weeks. Some books say 6 to 8 weeks. The point is, this is what decreases the respiratory complications. Important point, this has been asked many a times. Okay, so smoking needs to be stopped. Why alcohol? Alcohol is a enzyme inducer. Therefore, even alcohol, someone who's alcoholic needs to be told, do not take alcohol before coming for anesthesia. Okay, so I got a thumbs up from all of you. These are two important points in the PAC now. Airway assessment, addictions that need to be stopped. After that, pulse, BP, everything is the same as in medicine. Then you can see we are taking history based on respiratory system, RS, patient's history, CVS. We are taking in the abdominal, liver, kidney, what is history, diabetes, thyroid. We are asking about all those endocrine conditions, musculoskeletal. And based on this medical history, guys, we arrive on something which is the next important question, that is ASA grading of the patient. What is the ASA grade? So ASA grade tells you the medical condition of the patient. All right, based on that, so ASA grade is telling you the medical condition of the patient. Based on that, you decide the investigations. Based on that, you decide the consent. Okay, it basically tells you the risk, and that is the question asked in exam. What is ASA grade? Okay, so let me just show to you. This is how it comes in the PAC sheet also. Okay, this is the ASA grading. When a patient comes to us, this is how we write ASA grading. ASA, as you can see, 1, 2, 3, 4 and 5. All right. Okay, so ASA 1, guys, is any normal patient, okay, non-smoker, non-alcoholic, non-smoker patient, basically is anyone who's normal. ASA 2 is a mild systemic abnormality or someone slightly deviation from normal, like pregnancy. Important question that has been asked in exam. Pregnancy comes where? ASA 2. Geriatric patient comes ASA 2. Pediatric patient becomes ASA 2. Slight deviation from the normal or a mild systemic abnormality. When the systemic abnormality becomes severe, for example, someone is hypertensive or diabetic, it becomes severe. He's controlled on 2 medications, he's on insulin. This becomes moderate abnormality, which becomes ASA grade 3. So moderate systemic abnormality is ASA grade 3. What is ASA grade 4? That abnormality has become so much problematic, it has now become a threat to life. Means that diabetes and hypertension has become so problematic that it can cause MI, angina. It has become life-threatening. Can you see? The medical condition is progressing from a normal patient to getting more and more severe. That is the difference from ASA 1, 2, 3 and 4. ASA 5 is almost dead patient. It is called moribund patient, not expected to survive. Okay? Not expected to survive. That is ASA 5. And then, guys, there is something called as ASA 6 also. Anyone? What is ASA 6 then? Please. So I would like interaction if it's possible. ASA 6, grade 6 ASA. So Dr. Syed Madani, Dr. Shreya, Dr. Pooja, Dr. Rahul, Dr. Rizvi and Dr. Shadi Shuda. Good, nice name, I like it. So anyone? Wonderful, Dr. Dipesh gives that answer. Dipesh Karki gives that answer. Nice, I like that name as well. So ASA grade 6 is a brain dead patient MCQ question. Okay, brain dead patient, organ transplant. Correct. So brain dead ka bhi classification is done for organ transplant as Dr. Dipesh Karki mentions it. Absolutely correct. And this is where the questions come on ASA grading. Alright, apart from ASA grading, guys, then you're supposed to know the anesthesia techniques. All of you already know GA, regional, spine, epidural, this is spinal. Alright, various nerve blocks, all of you are already aware of it. I'm not going to go into details of types of anesthesia. Based on this ASA grading is how we decide the investigations. That is why the investigations are done. A normal patient will need only hemoglobin, platelets, TLC, DLC at the max, blood sugar. That's it. However, if you think a patient is coming ASA 4 who has threat to life, do you think will be sufficient with this much? No. He's having a cardiac abnormality. I will go for an echo. I will have to go for an ECG. Okay. So therefore, ASA grading helps you to find out not just the medical condition of the patient. This ASA grading is telling you the risk of the patient, the medical condition of the patient. It is telling you how to plan your investigations and is helping you to take the consent from the patient. ASA 1, normal patient, you will take a normal consent. ASA 4, this is where you will take a high risk consent. That is why this ASA grading becomes so important. Thumbs up everyone if you have understood. Fast, jaldi jaldi. Let me go to the next point then. Okay, there. So apart from that, then coming to the next point in the PSC. See, I'm covering up all the points on which questions are asked so that you are also aware of that. What medications are to be taken? What medications are to be omitted? Important question. Okay, what questions are to be taken? What medicines are taken and what medicines are omitted? So therefore, when we come to this point, what is to be taken? So it's important to remember what is to be omitted. As in, if some patient is suffering from diabetes, someone is suffering from hypertension, he'll be on few medicines. Alright, someone is having coagulopathy, he'll be on some medicine. So those patients, cardiac medicines, someone might be on thyroid medicines. So before the surgery, what should be continued and what should be stopped? That's the whole point. Okay, so what is to continue and what is to stop? It's easy to remember what are the medicines stopped. Okay, what medicines one will stop before the surgery? Anything that causes increase in bleeding. Okay, the biggest point here was about aspirin. Remember, nowadays aspirin is not stopped. Okay, because nowadays aspirin used is a low dose. However, wherever you're using high dose aspirin, it needs to be stopped 1 day prior to surgery. Apart from that, clopidogrel needs to be stopped. Okay, you need to stop heparin. Heparin is of two types: low molecular weight heparin, alright, unfractionated. Everything needs to be stopped. Warfarin, MCQ question, 4 days. Clopidogrel, 7 days. Important question. Okay, then psychiatric medications, MAO inhibitors need to be stopped. Okay, lithium needs to be stopped. Oral contraceptive pills, they contain estrogen, DVT, chances of DVT, they need to be stopped. Hormone replacement therapy, gynac, needs to be stopped. Okay, metformin, 3 days prior to surgery, stop it. Oral hypoglycemic agents, 1 day prior to surgery, stop it. Okay, insulin. Okay, insulin, you have to decide about insulin. Either some people give half the dose, some people omit the dose, so it depends. Ideally you give the last dose and you give 1/2 dose before and then you omit the last dose. You adjust it basically. We adjust the dose to half or 1/3 and omit the last dose. That is what is done here. Apart from this, some books say ACE inhibitors and ARB need to be stopped 1 day prior to surgery. Apart from that, everything else is continued. Okay, most of the other medicines are continued. So these are the common places where questions are asked that you should be knowing. Okay, hopefully you've gone through that and understood this part as well. Okay, then next point is that you should remember is about NPO status. All right, NPO. So if someone is NPO, how long? 2, 4, 6, 8, all is correct. 2 hours is for clear fluids, 8 hours is for heavy meal. Okay, so normally it is 6 to 8 hours that the patient needs to be fasting before surgery. However, for fluids it is 2 hours, and nowadays for children they say even 1 hour floor fluid is okay. Fluid, and remember fluid matlab clear fluid, not milk. Okay, 4 hours is for breast milk. Alright, then you have to be knowing about the monitoring part. So pulse, BP, all of you are aware. From anesthesia point of view, remember ET, CO2, capnograph. Capnography is a graph which is plotted for CO2. This is what you should be knowing. Okay, capnography. This graph becomes important. So apart from pulse, BP, which you people are already aware, ECG that we'll be studying in medicine. So pulse oximeter is an important thing in anesthesia. You're supposed to be knowing that. Pulse oximeter. Remember, capnograph becomes an important monitor. Supposed to be knowing that. End-tidal carbon dioxide. Okay. Then newer monitors like bispectral index become important. This tells you the depth of anesthesia. This becomes important. Okay. Neuromuscular monitor. This becomes important. It tells you the muscle paralysis. Differentiates. You will get to see fade with the non-depolarizing, and with the depolarizing or succinylcholine you get something like this. Okay, so you get fade with non-depolarizing. So this is neuromuscular monitor. It tells you depolarizing and differences between them. Correct. Curare cleft is seen with Dr. Dipesh gives that answer. Correct. Absolutely correct. So I think you guys are already aware of that. So I wanted to tell you, please study monitoring. Anesthesia machine. Cylinders become important. absolutely important. Even if you don't know anesthesia machine, still it's okay, but cylinders become absolutely important. You should be knowing the colors and the pin index. All right, cylinders important: air, oxygen, nitrous, entonox. Of course there are others, but they are important: air 1.5, pin index 2.5, 3.5, and entonox is 7. So just remember air, oxygen, nitrous oxide, and entonox. So air is 1.5, oxygen is 2.5, nitrous is 3.5, entonox is 7. Same thing with color. Air is grey with white shoulder, oxygen is black with white shoulder, nitrous oxide is blue, and entonox is blue with white shoulder. Okay, so remember, wherever there is oxygen, there is going to be white shoulder. Air contains oxygen, hence it has white shoulder. Oxygen itself has white shoulder. Entonox is nitrous oxide plus oxygen, it also contains white shoulder. Hopefully you know that. So these two things are very important: pin index and the colors related to anesthesia machine. Thumbs up guys, did you understand this point? Everyone? अरे किसी का thumbs up नहीं आया. When I get a thumbs up, it becomes interactive, na? That's why it becomes a little bit difficult to take a session on YouTube, but it's still okay. Okay, so Dr. Deepesh says concept clear. Concept, sir. Okay, correct. All right. Good. So I hope you guys are also aware that we have our iconic subscription where we are taking Unacademy with Prep Ladder. Both is available. All right. So you can just see all the things on the net. I'll just describe it to you as well if you want to. So when you take the iconic subscription, guys, you also get the same live classes that we are taking on Unacademy platform, the plus courses and the batch courses which are there. Apart from that, the live tests and the quizzes which go on, of course, because it goes on and on and on. Apart from that, with the Prep Ladder part, you are having the video lectures and the question bank and the rapid revision courses that they are taking over there. Okay, I think according to me, this works out as one of the best things, because not just you have a recorded lectures which are available, it's the basic live thing also that you get along with it. I mean, that becomes one of the best things which I feel. Okay, so the iconic contains, this is the way that you go about it. So it contains, along with Unacademy, the Prep Ladder, both of them, and then you can decide upon the amount of days some people want it. All right, or just if you want plus, where we are accessible. Okay, so according to that, this is the way you proceed to pay. Okay guys, this one of the best things that we are doing it for the last 3 months. I hope you are aware for it. This at 8 p.m. every day we take 20 questions. We call it T20. All right, 20 questions MCQ. They are absolutely free, guys. Please join it and you can see how you are prepared for the exam. Okay, every day guys at 8 p.m. there are 20 MCQs that we do. They are absolutely free. Please take part in that. It gives you a sense as to where you stand and how you're doing with the MCQ ratings. End of the day, I feel MCQs are the most important way to go forward. Please solve the MCQs, and the MCQs are the ones which make you realize where you're standing. Okay, so download the Unacademy app, guys, and remember, there are absolutely free things available. The special classes which are there, they are absolutely free. Even today at 8 p.m. I'm going to be taking an FMGE special free class today itself, okay, where I'm going to discuss MCQs. Because this is a YouTube platform, it is not easy to discuss MCQs with the answers, but today itself at 8 p.m. so you can just download the app and absolutely free 8 o'clock MCQs. Okay guys, so I'll catch up with few of you from there also, so you can discuss the MCQs, and these are more targeted towards the FMGE exam. So I'll be discussing the concepts also as well as the questions today itself. Now going forward, so we had discussed about few things about the PAC. I discussed few things from whatever is going to be important there. Then we came down to the anesthesia machine. We saw few things about the monitors that I told you. After monitors, guys, and the anesthesia machine, remember, anesthesia machine then comes out to breathing circuit. Okay, so guys, breathing circuit becomes an important part, because breathing circuit is what connects the anesthesia machine to the patient. So this breathing circuit you have to remember, and they're of 3 types. They are open, semi-open, and closed. Okay, so their classification becomes important. In the semi-open, you have the Mapleson system, which is Mapleson A, B, C, D, E, and F. This part is the question where they ask you maximum times. They ask you even about the closed circuit. Open, they normally don't ask you. So breathing circuit is an important question. Okay, then so we discussed PAC, anesthesia machine, breathing circuits, monitors. So I'm just telling you the points which are important for you to study. By now, of course, I know all of you must have studied this, but still emphasizing So these are the things that you need to emphasize upon. Talking about GA, you need to be knowing the drugs, the most important things here. So in drugs, of course, you guys know inhalationals and IV drugs. These are the induction drugs. Okay. So inhalational, even if you don't remember the old ones, I feel it's okay. But the newer ones, halothane, sevoflurane, isoflurane, desflurane, not to be forgotten, guys. These four you should be knowing. Similarly, when you talk of IV induction agents, thiopentone, propofol, ketamine, etomidate, alright, these four absolutely you should be knowing. Absolutely. Remember, so at the end of the day, do you realize if someone says what are your important points to focus upon, it's not everything. There are so many old IV drugs also, okay, althacin, propanidid, but they won't ask you in the exam normally. See, we are targeting our studies just towards the exam right now. Okay, so just pay attention to the places where questions will be asked. Normally questions get asked on these points, which are important, which are in use, and for which you should be aware. Dr. Dipesh says his history or his D. I didn't understand that point, but anyways, let me go forward. So these are the points which are important according to me, inhalational and IV drugs. Then we go to muscle relaxants when you talk of GA. So remember, small points are important. Like in halothane, you need to remember it is sweet smelling, hence becomes the drug of choice for inhalational induction. Okay, important point. You should know H for halothane, H for hepatitis. You got to remember that, halothane hepatitis. Okay, MAC and solubility, again, Dr. Dipesh, if you understand, well and good, but if you don't understand MAC and solubility, forget it. It's the point I'm just saying how to concentrate at the last minute for the exam. Okay, you're absolutely correct, those points are important, but in case last moment you can't put your attention onto that. Okay, same thing, isoflurane, you should be knowing that it maintains the cardiac output out of all the drugs. Desflurane, you should be knowing slight increase in heart rate and BP is something that takes place only with desflurane. You should be knowing desflurane is the one which has heated vaporizer. These are small points which keep on getting asked again and again. Thiopentone, contraindicated in porphyria. 1,000 times it has been asked and it will be kept on asking again and again. These points don't forget. Propofol induction drug, we know that, but it has anti-emetic effect. Every second, third year they ask you this question. Cardio-stable drug, etomidate. Every second, third year they ask you this question. Hallucinations produced by ketamine, they ask you this question. So the point is, these small points you should be knowing, alright, about all these drugs. Talking about muscle relaxants. So muscle relaxants, two types, depolarizing and non-depolarizing. In this depolarizing, there's only one drug, succinylcholine, and you got to remember that. There's no way about it. Talking about non-depolarizing, you normally classify them as long-acting, intermediate acting, short-acting, and ultra-short acting. Okay, so long-acting, you will have drugs like pancuronium, alright, doxycurium. So remember, pancuronium becomes important, doxycurium becomes important. They are long-acting ones. Okay, so they are asked in the exam. More important is in the intermediate acting. Here you get vecuronium, rocuronium, atracurium, and cisatra. They all become important. When you talk of atra, cisatra, everyone knows Hoffman's elimination. Every second, third year they ask you this question. Okay, so you need to remember, vecuronium is again a cardio-stable drug, hence it's the most common drug used. Rocuronium, remember, pain on injection, plus fast-acting drug. Important points. So these are small points. Okay. Okay, so Dr. Dipesh is saying how to remember them. Correct. Absolutely correct. Alright. Then short acting, mivacurium. Remember that. Again, it is asked many a times. Short acting. Ultra short acting, you have gantacurium. Okay. Newer drug. And this is where they can concentrate and ask you a question. That's about muscle relaxants. Okay. So when you talk of GA, you have discussed about the inhalational agents, IV agents, the muscle relaxants. Alright. So this is done. Apart from these drugs, you have to remember that there are other drugs also that can be used in anesthesia. Opioids. Anyway, you study them in pharmac, but opioids become important because they take care of pain. Analgesia. Hence, it becomes a very important part of anesthesia. Then, local anesthetics form an important point. Not just how the drugs are working, like lignocaine, bupivacaine, ropivacaine. Okay, you have these drugs working out, the mechanism of their action, how they are working out. More important that these are the drugs that are again used to give your spinal, epidural, regional anesthesia, various nerve blocks. So This becomes an important part, local anesthesia and regional anesthesia. Now if you ask me, do you need to study all the nerve blocks? If the last moment studies, I'll say no. Just read spinal epidural. Don't try to read so much about the nerve blocks. At the last moment, it's not going to be helpful. Last moment, please pay attention to lignocaine, bupivacaine, ropivacaine. For example, lignocaine, most common used drug. Bupivacaine, cardiotoxic drug. Okay. Ropivacaine is the S enantiomer. It is less cardiotoxic and hence it is being used. Okay. Ropivacaine is S enantiomer of bupivacaine. Alright. It's less cardiotoxic. That's exactly why we are using it. So these are the small points that you need to remember when you're appearing for the exam right now. So GA, local anesthesia, regional anesthesia. Apart from that, you need to know intubation. Intubation is an important point in anesthesia. Intubation and LMA, laryngeal mask airway. So there are other things also, but intubation, LMA, laryngoscopy. These three things can come as image based, not just from anesthesia, even in pediatrics or medicine. Forget the branch, but you can get image based in all these three. Okay, so important point, don't neglect intubation, LMA and laryngoscopes. Okay, after that, do remember CPR. Okay, you have to pay attention to CPR also. You should be aware about that. Alright, so CPR in the sense that you should be knowing that the chest compression rate is 100 to 120 per minute. Alright, the depth is 5 centimeter to 6 centimeter. Alright, so these are the places where they keep on asking you questions. The ratio is 30:2 everywhere except pediatric with 2 rescuers when it becomes 15:2. Common questions that they keep on repeating again and again. Concentrate on these small points, guys. Okay, so these are the important ones. Now, apart from all this that we studied and I discussed with you, so I just wanted to introduce to you this one also. We have an intensive batch which I am starting. I'm going to cover anesthesia in 6 hours. Okay, we took a half an hour session today where I tried to discuss things. So I'm going to take in 6 hours and try to finish off anesthesia, the important parts for NEET PG 21. Alright, so we are a whole group of people. Dr. Dipesh, the changes are not much. The same thing in pediatrics. Basically, whatever the changes in neonates, it's the same thing that have been there. It's the 2019 update, which was the change, is the same thing which has happened in 2020 also. Apart from that, there are hardly any changes. Okay, they're not much. ACLS nahi, I'm talking of BLS only. Okay, BLS, ACLS. ATLS, yes, there might be few changes. I'm talking of BLS and ACLS. Alright, depending on the 2019 update, it's almost the same thing. Okay, guys. So this was the intensive revision batch that I was talking about that will finish off anesthesia in 6 hours. Okay. Any questions and doubts, guys? You want to ask me something? Yes, Dr. Dipesh, other guys. So this is how we cover up the anesthesia part, guys. Again, in December and January, for the people who are not appearing right now, who want to appear, who are appearing the next year. So this is how we'll try to cover up complete anesthesia. So this is between December and January. This is a complete course in anesthesia, which we start in December and Jan. Okay, guys. So any questions or doubts, please ask me. Alright. Otherwise, then meet me today at 8 PM Unacademy. Alright. We have lots of sessions, today is absolutely free. Alright. It's a special class that we have. Just download the app. And I don't know whether you are supposed to use a code or not. Otherwise, you can use my code or any code. I don't know nowadays they've started or not. Okay. So you can join me and I'll be discussing some MCQs I've already prepared there. And okay, so Dr. Dipesh says no, sir, from my side. Absolutely okay, yaar. The people who prepared, absolutely okay. So guys, any questions or doubts? Dr. Dipesh says no. No one has any questions or doubts. So it was good to join you. Monday again, I'll try to come with a small session again. Okay. Maybe I'll try to take some MCQs, or if there's any subject that you want me to take, then do let me know. Is there some point that you guys want me to take? So nothing. Okay, guys. So I'll take you leave then. All right. It was a good small session according to me. The point was I tried to focus on the points that you need to be prepared from anesthesia. Remember, PAC is where the questions come. Very commonly they've been asked recently. Monitoring becomes an important part. Okay. Anesthesia machine becomes important along with breathing circuits. Okay. Then when you discuss GA, remember it is inhalational, IV, muscle relaxants, commonly asked, local anesthesia, regional anesthesia, okay, CPR, intubation, LMA. If someone will say last minute preparation, guys, these are all the points that you need to be knowing. Okay, all right. So thank you for joining me, and I'll catch you again on Monday with a small session again. Thank you so much. Bye bye.